Hi friends, I'm Dr. Shweta Goswami. I'm the founder and medical director of Zeeva Fertility. We're based out of Noida and Delhi NCR. I think an important question in all of our minds when we think about a treatment like IVF is which IVF center should we choose, and what should we, the questions in our mind, or on what parameters should we choose which center we should go for. Now, I think it's a very pertinent question because IVF is an important treatment. It has great success rates to the tune of as high as 70-75% per cycle. Of course, we are looking and assuming that everything else is, working in the right fashion, which means the medical reports of the patients are important, but at the same time, at the back end, how is the medical team, the embryology team, the infrastructure? I think all those are very important questions to keep in mind when we look at an IVF center. Now, one basic advice that I would like to give as a fertility specialist is that, see, price is an important part in an IVF treatment. However, like we do it for our day-to-day lives, everything that is a cheap center may not be the best center that you might be looking at. So talking about the first point, I think price and the cost of IVF treatment is very important. But here I would like to reiterate that there are, a lot of centers who might look that they're not so, expensive. There might be other centers that might have a higher cost. So I think we need to delve deeper into that. We need to understand, one, are there any hidden costs? Two, you may do an IVF a little cheaper, but is it worthwhile if you don't have the kind of infrastructure and the quality of healthcare that you deserve in an IVF treatment? So please do balance that out. Of course, nobody should be, overcharging you for anything, but I think at any decent IVF center across the country, the costs are kind of constant, plus minus a little bit here and there. But very importantly, if you do the IVF from the right place, which has good results and which has excellent success rates, paying a little extra might still be okay, but it's very important to keep that in mind. So keeping that in mind, the second parameter that we have to look at is to try and understand the success rate of the IVF center. Now, unfortunately, in India, we don't have, those kind of European or guidelines that exist in the UK, where every center has to publish their success rate. The success rate is also, of course, individual, but then even age-wise success rates can be looked at. But when we don't have that kind of data here, I think we have to look very importantly at the transparency that's available in the center, and we must have a basic discussion with the doctors there and the team there as to what is the success rate of the center. Now, again, please understand the success rate can be quoted as anything and for, anybody can say anything. The important thing is it is anyways a very individualized clinical success rate also. So for you as a patient, this IVF success rate may anyways be just about 20% in case your age is higher or your egg or sperm quality, counts are not so good. However, for a young patient with everything else going fine, the success rates today can be as high as 65 to 75%. So I think just saying that we have a 70-80% success rate also is not correct information. So we must have that dialogue with the center that, okay, what is the success rate for me? And for patients like me, what do you think that the kind of success rate can be? And third, very importantly in my mind, looking at a center which is ethical and transparent is very important because, see, the whole fertility treatment is actually based on a lot of trust, right? And therefore, no matter how much research and survey we do, there are certain things that we can never figure out. So, for example, once egg retrieval happens, the embryos are being made, you really can't constantly monitor what's happening, but you have to have an open system. And I'm sure that all of us can perceive and see. And we should be able to see that, yes, we're getting the right information. We are being told at every step what's happening. You have every right to know how embryos are culturing, what is the final report, what is the final number and the grading of the embryo. So this kind of a open and transparent discussion should be happening because then that gives you more confidence in a particular center. So I would say you must insist on something like that, because it would help you to also understand how the IVF treatment is going. See, not every IVF treatment cycle may go in the perfect manner, and there are things that are beyond control for anybody. You may not have very good egg quality or sperm quality or an embryo quality, but you need to know the reality as to what happened. So I think having a center which is very transparent in its approach, is very ethical in its approach, and tells you clearly how things are working, is going to be very important also. Right. So keeping in touch, the fourth point that I would like to say here is that because IVF is an integrated science, so you need a doctor who's definitely very competent. You must try and even see if they're specialized in fertility. So again, we have reproductive endocrinologists, we have 2-year programs, we have 1-year programs, we have only 3 and 6 months programs of fellowships, post gynecology degree. So we should also try and see how much experience does the doctor have, what is their kind of success rate, have they undergone vigorous fertility training or not. So these are also important parameters to discuss with the center or your doctor when you meet them, because that is very important in terms of your treatment results. Similarly, for a doctor also, it has to be a team approach. So the back-end team, the embryology team, has to be very strong. So does the center have a full-time embryologist? Are the embryologists fully trained? Are they doing batch IVFs, or are they doing IVFs on an ongoing basis? Also gives you the confidence on how the lab is functioning. And of course, the infrastructure. So is the treatment that I'm getting world class? Is the IVF center, because the IVF lab is very important, is it equipped with all the important equipments that we need? So you could have a workstation, or you could have a laminar airflow in the lab. It must be equipped with ICSI, which is intracytoplasmic sperm injection. So we should have micromanipulators in the lab. We should have good incubators in the lab. We should have a very good monitoring system, a QC/QA, a quality control in the lab. Preferably the lab should have an AHU or an air handling unit, because that's how these labs become clean room technologies. And lower the particle count, lower the ROS count, better is going to be the result. So I think we must try and understand. See, a lot of things cannot be shown to you, but at least, as I said, if the center overall is transparent in its approach, you can figure out that yes, these basic technologies do exist. Good labs, would tend to do an extended culture as to what we call a blastocyst culture. Also, embryo freezing is an important protocol. PGTA or genetic screening is available in a lot of labs. So are these technologies available or not is something that we should discuss. So as I said, to summarize, I would say we have to look, of course, at the price point, but not at the cost of quality of healthcare. We have to look at very good trained medical professionals. We have to look at trained embryologists who are, taking care of the lab constantly, because that's what's important. We have to look at good infrastructure, and overall, we have to look at an ethical and a transparent center, which has a hand-holding approach, where they have counselors, they have people you can talk to on board, and who give you clear-cut directions of where things are going. And very importantly, at the end of this all, I think you should have a proper embryology summary. One of my misfortunes, what I don't see is from a lot of centers, patients even don't get a complete embryology report. I think we must get that. We must get all reports in a transparent fashion. Who conceives and who doesn't after IVF, because it's not a 100% procedure, is not in our hands. But if we are looking at a center which is transparently telling us what's happening, we at least know we have been well taken care of. Wish you all the best to choose the right center. Please choose it wisely, and do go in and take the help of an IVF procedure in case you're finding it difficult to conceive. And that is what the treatment you're looking at, because it is a great scientific advancement that's helping so many couples to conceive. Thank you so much.